I'm Katie. I'm a second year paramedic student. Can I just confirm your name and your date of birth?
Yeah, Visa 12th of June 1985.
Right, thank you. So today I'm just going to perform a neurological exam on you. That involves me just looking at your eyes, just testing your speech, looking at your arms, your hands, doing a few tests with them, and looking at your legs and feet. Is that okay with you?
Yeah.
Alright, so are you in any pain right now?
No.
So first I'm going to look at my patient, check to see if she's comfortable, and also observe on the side of the bed if there's any medications or equipment that she uses. Also just looking at my patient again, just to see if everything is symmetry or in line, and then I'll proceed with the examination. Yeah. Right, so now I'm just going to test gait. To test your stance, I just want you to take 4 steps forward and 4 steps back. And I'm just looking at her balance, her posture, and to see if she's unsteady. Right, testing stability. The tandem walking test, just 4 steps forward, 1 foot in front of the other, and heel to toe. Also just to test balance and to see if she's unsteady. Right, thank you. The second one, the heel to toe, that just means you taking 4 steps forward on your heels first, and then 4 steps back on your toes, okay? Right, thank you. If the patient was unable to do this, there will be a positive sign for ataxia, which is the loss of control of bodily movements. Okay, the last test, the Romberg's test, would like you to just close your eyes, put your hands by your side, make sure you're supporting the patient, just observing them for 20 to 30 seconds, just to seeing if they're swaying, and if there is a mild sway occurs, then that's fine, but if the patient appears to be swaying quite a bit, then that's a positive sign for ataxia as well. Thank you. Done. So now I'm just going to test the patient's speech. I'm looking for any slurred speech. I'm looking for clarity and fluency of the speech also. So could you just say for me, Baby Hippopotamus and 42 West Register Street?
Baby Hippopotamus, 42 West Register Street.
So had the patient had trouble saying this, this would be a sign of aphasia, which is the inability to produce speech due to brain damage. So now I'm just going to test the patient's eyes. If you could just look up at me and follow my finger. Keep your head still while I'm doing this. So I'm just looking for any rapid involuntary movements. Done. I'm just going to test the patient's arms. First off with the pronator drift. So I'm going to ask the patient to hold out your arms and close your eyes. I'd like you to turn your arms over so your palms are facing upwards. I'm just going to observe the patient and see if there's any drift or any pronating arms. So signs of pronation will suggest a peroneal lesion. Thank you. So now I'm just going to test for rebound, asking the patient to once again close your eyes please. Hold your hands out and place your palms upwards. So now I'm just going to push on this, and a smooth return is normal. However, weakness and lack of coordination will suggest a cerebellar disease. So, thank you. So now I'm going to test for tone in the arms, and normally this will be done with the patient undressed from the waist up, just to give me a better look, but I'm just going to verbalize that today. So first, can I have you hold your arms up like that, and I'm going to press against, and right, thank you. Now I'm just hold your wrists out with a closed fist, just rotate them for me. Alright, I'm going to push down on them, up, right, and your fingers. Right, and then hold out like that, and I'm going to push down, press up. Thank you. So what I'm looking for is any involuntary or spasmodic movements, and this could indicate Parkinson's disease. I'll also compare side to side, see if they're equal. Thank you. So because I don't have the equipment to test reflexes, I'm just going to verbalize where they would test and what they're looking for. So they would be testing the bicep, the tricep, and the supinator area, and what they're looking for is any hyperactive deep tendon reflexes, which may indicate upper motor neuron lesions. So the next test I'm going to do is called the finger to nose test, and the inability to perform this test accurately may suggest cerebellar pathology or dysphagia. So I'm just going to ask the patient to touch her nose and then touch my finger, but I'm going to move my finger every time she touches her nose. Okay, thank you. So the next test is to test for this dysdiakinesia. I'm going to ask the patient to pat the top and the palm side of my hand and repeat on the other hand. So the inability to perform this rapidly alternating movement can suggest ataxia. So with your right hand, just tap the bottom and the top of my hand. And just speeding up. Thank you. Also the same with your left. And just speeding up. Thank you. So there are no involuntary movements there. Thank you. So I'm going to look for reflexes in the leg, and I don't have the tools to do so, so I'm just going to show where. So knee jerk and ankle jerk, and if absent or decreased may suggest polyneuropathy. Thank you. Now I'm going to test for tone in both legs. So I'm going to start with the leg roll. If I roll one leg, the foot should just flop freely or independently. So just going to roll it outwards. So there's no signs of involuntary movement, and also with the other leg. Alright. The next one is the leg lift. I'm going to lift up from the knee, and the heel should remain in contact with the bed. Alright, thank you. So now I'm just going to test for coordination, and one way to do this is the heel to shin test. So I'm going to ask the patient to run their heel down the other leg from the knee and repeat in the other leg. So in a cerebellar disease, a coarse side-to-side tremor of the leg or foot will be noted. Thank you. So that concludes my neurological exam. Make sure you thank the patient, wash your hands, and tell the patient that they can get dressed. So in a pre-hospital setting, conducting a cardiovascular, neurological, and respiratory examination may not be possible as it takes time and it depends on the urgency of the situation. The acuity of the patient, whether it's status 1, 2, 3, or 4, depends on how sick the patient is. For example, a patient having a mild asthma attack may be left at home if resolved. However, they will have to meet a certain criteria, such as one listed in the clinical procedure guidelines. They may also be taken to the hospital, but not as urgent, so they will be taken as a status 3 or 4, compared to a patient with a suspected traumatic brain injury or one being short of breath due to anaphylaxis. This patient may require more treatment from a ALS or an ICP and will be rushed to hospital as a status 1.